Thank you, Mr. Chairman, and Mr. Pallone for convening today's hearing. This epidemic has touched so many people in each of our districts in so many ways, so I'd like to talk about the specific challenges in my district facing Westchester County in New York and the Bronx in New York City. I represent a large portion of Westchester where opioid-related deaths shot up more than 200% between 2010 and 2015. But that changed in 2016 when the rate of opioid-related deaths in Westchester fell nearly 30%. And evidence suggests this was thanks to the overdose reversal drug naloxone. That's why I didn't go to medical school. Law school was easier. Between 2015 and 2016, Westchester EMS workers and law enforcement began using this medication much more frequently following state and local efforts to make it more accessible and ensure first responders know how to use it. So I believe this shows what's possible when we afford communities the resources they need. So Congress must continue to invest the necessary funds to respond to the opioid epidemic and support proven public health approaches spanning the entire spectrum from prevention all the way to recovery. I am so encouraged to see a devastating trend reversed in Westchester, but this battle obviously is far from over. Naloxone is certainly a lifesaver, but it could also be a game changer. And if we can connect people with treatment after they've overdosed, we might even save more lives. So, Dr. McCoss-Katz, how are we doing as a country with respect to connecting Americans with treatment after they've overdosed, and how can Congress help us do even better?
Yes, thank you for that question. We have, SAMHSA has a number of programs that are demonstration programs across the country that address issues around the need for naloxone as an antidote, treatment in EDs, and what we are doing and the models that we're working with include bringing peers, people with lived experience of opiate addiction into the emergency department so that they can talk with people who have experienced an overdose and provide them some guidance and help and support to get them to treatment. And we're in the process of having these programs they're ongoing right now, and we will be evaluating those programs. I will tell you though, I'm from Rhode Island. I come to federal service having been a practicing physician, a psychiatrist in Rhode Island, and was involved with the opioid epidemic in Rhode Island. And one of the things that we observed in Rhode Island was that a lot of times when people are reversed, they're not comfortable. Sometimes they'll experience opiate withdrawal when they're given naloxone, and they're not ready. They're not ready to commit to treatment at that time. And so what we've started doing was getting consent from people so that our peers could follow up with them in communities. And we think this is going to be a key piece of connecting people to treatment, and we'll be expanding those kinds of models at SAMHSA.
Well, thank you. And let me say, the other part of my district is the Bronx. We're not seeing, unfortunately, the same signs of hope there. More New Yorkers died of overdoses in the Bronx than in any other city borough last year. 85% of those deaths involved opioids. And despite their proximity and attached to each other, Westchester and the Bronx have many differences. On average, communities in the Bronx have fewer resources. The uninsured rate is higher, and communities are more diverse. So the disparity that we're seeing in the trajectory of these counties' opioid epidemics is also an economic disparity and a racial disparity. So the consequences of this disparity are really heartbreaking. Your zip code should not determine your health or what you get to make you better. We need to do better. So on the basis of that statement, let me ask Dr. Schuchat and Dr. McCoss-Katz again, how can Congress address these disparities and ensure that every person, regardless of sex, race, location, or income, has the same ability to get treatment?
I will just say SAMHSA has an Office for Behavioral Health Equity. We're very involved in monitoring those kinds of issues, and we work very hard to provide guidance to states and communities on culturally appropriate, culturally sensitive interventions, and we will be continuing that work.
Dr. Suchak?
Yeah, and one of the things CDC was able to do with the increased funding this past year was strengthen the syndromic surveillance, go from 12 states to 32. And what that has allowed is better data on where the problems are, hotspots or inequities can be followed up, and so you can get more resources. Even the naloxone distribution can be targeted to where the overdoses are highest and expanding services into those areas. I know in the New York City area, that's been done, trying to figure out where the need is and get the clinical services closer to those hotspots.
Thank you both. Thank you, Mr. Chairman.
Thank you, Mr. Engel. We'll now go